The Anti-Quackery Committee of the Rivers State Ministry of Health.
Briefing newsmen in Port Harcourt, the Rivers State's capital, the State Commissioner for Health, Dr. Adeze Ore, disclosed that the decision became necessary over alleged unprofessionalism by the facilities, which, according to her, engaged the services of unqualified personnel. Ore noted that the government sealed the 6 private hospitals, including a facility operated by a foreigner, for operating without authorization and also engaging in unprofessional conduct. The sealed hospitals, according to the commissioner, include Pali Hospital and Maternity in Ogali, Success Maternity in Aleto, and Noble Life Maternity and Computer Test in Aleto, all in Eleme local government area of the state. Others are Futurist Medical Center in Omagwa, Ikwere local government area of the state, God Bless Hospital in Kongkong, and Asha Specialist Hospital on La Quinta Street, Afam both in Oyingbo local government area of the state.
The first is Pale Hospital and Maternity, located at Ogale, Eleme local government area. There, they were practicing unsupervised against the provisions of the Medical and Dental Council of Nigeria, which requires licenses to practice medically. They were conducting surgeries without documentation and proper review. It was an unregistered hospital, meaning that it was not registered with the Rivers State Ministry of Health. The environment was unsanitary, and it provided a training school for quacks. So not only were they practicing quackery, they were churning out others to go forth and do the same. They were self-advertising, running a social media channel through which they advertised themselves and their services and attracted people to their facility. I'm a medical doctor by profession. You will not see me set up an accounting firm and advertise myself for people to procure my services in accounting. That is criminal. That is false pretense. And so by advertising and seeking to attract people to come to those facilities, knowing fully well that you do not have the training, the qualifications, or even the adequate manpower to support the delivery of those services, is purely criminal. And so I would lean towards the fact that people are seeking to exploit the fact that healthcare is something that everybody needs, and they're seeing it as a money-making venture. And it is not necessarily about the lack of available facilities for people to get healthcare services. Of course, there are some recurring themes in some of the facilities, but there are some that, if they go through the process, first of all, they have licensed and registered practitioners delivering service, and maybe it's an issue of licensing, making sure that they're adhering to standards. Over time, they may meet those conditions and criteria. There are minimum standards for certain health facilities. If a facility meets those standards, there is no reason why they should not be reopened. Several months.
She lamented the spate of unethical medical conduct by unscrupulous elements, citing these facilities outside the state capital in order to conceal their illegal activities and even carry out surgeries without the requisite personnel, facilities, and supervision, thereby endangering the lives of patients. Ore warned medical doctors and pharmacists against crossing the lines of ethical practices by collaborating with quacks to perpetrate such unprofessional conducts, which have resulted in deaths.
We can see that these perpetrators have gone beyond providing these unprofessional, unethical, and disastrous services to the people. Beyond that, they provide training, further proliferating their numbers so that other people can go into other locations and do the same. And if you've also observed the trend, a lot of them are going out of the main city of Port Harcourt, perhaps to evade notice and being brought to book by the authorities. We had realized that we had a massive problem within our health sector. The proliferation of quack medical practices and medical practitioners, jeopardizing the lives of people living and working in Rivers State.
The Commissioner urged all unregistered facilities to visit the Rivers State's Ministry of Health to understand the conditions and criteria for registration, reiterating that the state government maintains zero tolerance for quacks and unregistered facilities. Jude Aweke reporting for VOS TV News Benin.